Hey, Grunkins peeps, Dr. Lana's in the house talking today with my coffee crossing about myocarditis associated with mRNA vaccines. Those are those messenger RNA vaccines, so the Pfizer and the Moderna. And this is a big topic, and I'm really passionate about vaccinating because I really hate COVID. And all my boys are vaccinated. Everybody in my family is vaccinated except for Lily. And by golly, I hope she got the real thing in that trial. So what is myocarditis? Well, myocarditis is when you have inflammation of the heart muscle. You can also have pericarditis, and that's inflammation of that tissue of the sac that surrounds the heart. The vast majority of myocarditis is caused by viruses. Yes, the ones that you come in for each and every day, where your kid has a fever or snotty or has a rash or is vomiting or has a headache and a sore throat. And we just say, push fluids, treat symptomatically, it'll get better. The estimated incidence of myocarditis in children each and every year pre-COVID, 1 to 2 per 100,000. You know, that's actually, not completely uncommon, really, if you think about it. So let's, though, look at basically what did they find, okay, when the ACIP and the CDC kind of convened for this meeting in June after kind of seeing these signals of this increased incidence of myocarditis or pericarditis or myopericarditis within kind of this younger age group, especially in men. Well, they did establish there is a link. It is still incredibly rare, and it is most common right after that second dose. So if we look at young men, just in general, they estimated it to be about 0.00095% or 12.6 per 1 million second doses given for young men. But if you kind of parse that out a little bit more and look specifically at the 12 to 24 age range, then it is about 50 to about 69 cases of myocarditis per 1 million second doses given in that age group, right? With myocarditis, what they saw is the vast majority of these people recovered very, very well, very quickly, in fact, usually within 2 to 4 days. They did hospitalize most of these guys, and I think there were some girls in it, and just to monitor their enzymes and their echoes and their EKGs. And like I said, the vast majority of them did great. Over like 96% of them had gone home by the time of this study, and there were no deaths, all right? So I think that is something to remember as well. So let's just talk about the risks of COVID, okay? So we've talked about the risk of myocarditis. Let's just talk about the risk of COVID. I'll poke myself in the eye, I got so excited. When we look at COVID, all right, teens and young adults, as of right now, have the highest incidence of COVID-19. And there's a vaccine for these guys. There's a vaccine now, okay? It's still incredibly rare in kids, but it does happen. But this kind of like teenage into young adult group, they are just going gangbusters with infection, especially with the new variant, stupid Delta. We'll get to that one later. But as of, I want to say like mid-June, there had been 400 cases of COVID in children. Of those, 40,000 of those children were hospitalized. Of those hospitalized, 300 died. And out of that group, there were 4,000 cases of MISC. Remember, that's that multi-system inflammatory syndrome in children. Bad. Y'all, that is bad. Those kids are sick. They're not mildly ill. They are sick. And 400 deaths within those 4,000 cases. And almost 75% of those kids that had MISC had myocarditis. All right. Let's look at this recent study that was done by JAMA. And they looked at Big Ten athletes who were COVID positive, who had been COVID positive. So basically they looked at those that were just positive maybe on a screening test, or those that had mild symptoms. So, and those that actually, were sick from it. But what they found, okay, guys, this is really important. What they found, even in asymptomatic individuals, was there was a risk of heart damage after COVID infection, even mild. Okay, guys, what they saw out of these, hundreds and hundreds and hundreds of Big Ten athletes, they saw that 2.5% of these kiddos had an abnormal MRI. So what they did is they did this MRI scan with this gadolinium scan of the heart to look for damage, and they found it, 2.5% of these kids, okay? So that's 1 out of 40. And these are athletes. These are the healthiest of the healthiest. Kids are so in shape. 1 out of 40 of them showed evidence of their heart having damage. That's a big deal. That is a big deal. What about that risk, guys? I don't like that risk. So if we look at another just set of data, the CDC actually estimates for 12 to 17-year-olds, for every 1 million second vaccine doses delivered, then we are preventing 215 COVID-19 deaths, 75 ICU admissions, 215 COVID-19 hospitalizations, I'm sorry about that, 75 ICU admissions, and 3 deaths are prevented for every 1 million second doses given within the 12 to 17-year-old age range. And did you know, in terms of that, around 50 additional cases of myocarditis are to be expected. Remember, the vast majority of those cases that are to be expected after that second dose, mild, most having a full recovery, meaning no damage to the heart after a few days. Big deal. Okay, guys, big deal. So let's just talk in general, though, the risks of vaccines. We know with everything, meaning getting up, eating a sandwich, driving to work, you incur risk. You incur risk when you take a Tylenol or an ibuprofen because you have a headache. You incur risk when you give your child antibiotic. Okay, we all incur risk. Vaccines are so closely monitored, though, by the FDA. Okay. And we know that we have these 2 reporting systems, especially for COVID vaccines. So the VSafe and the VAERS, okay? VAERS can be used, but the VSafe was created specifically for just COVID. So the VAERS can be used for other vaccines as well. And if we look at vaccination side effects, right? Vaccination side effects in general, okay? Some are severe. Guillain-Barré. You see that with flu shot, anaphylaxis, thrombocytopenia, even death. There are severe vaccine reactions. However, they are so rare when giving that vaccine that the benefits of giving that vaccine far outweigh being infected by the disease, because they believe the risk of death or having some sort of significant morbidity from that disease, right, is way more than your risk of having a significant adverse event. And Dr. Offit, he's like, I love that guy. He's one of my favorites. He's the vaccinologist and immunologist. He was a pediatrician that went on and did all this work. And he is at CHOP, and he was a co-creator of the rotavirus that we give your kids. But he went on to talk about these side effects from vaccines. And basically he said that there is no vaccine that we know of yet that we have not seen a significant adverse event within the first 2 months. So if you're going to see an adverse event from a vaccine, it's going to be within those first 2 months. All right. And he said in 200 years, we have not seen an adverse event happen after those 2 months of the history of vaccines here in the US. That's a big deal, guys. Big deal. So your risk right now, especially with more transmissible variants and, with people being vaccinated, is your kid is either going to get COVID, okay? Because the variants are just going to keep mutating and become more and more transmissible. So your kid is going to get COVID. It's not like you can ride this out anymore with a mask and stay home, because no one else, is doing that. We've got to get back into society. So you're going to get COVID, or you can get the vaccine. And the vaccine will either completely protect you from being infected, or you will be, asymptomatic, have no idea that you're even infected. And even if you get that breakthrough case where you get the sniffles, it's way better. It's way better than your chances of having long COVID or your kid having MISC. We see long COVID in kids. I have patients with long COVID. Do you see what I'm saying, guys? So your kid's either going to get infected or you're going to vaccinate your child. And I would hope that you would vaccinate your child. As a mother of 3 teenage boys, they all got it. I was like, you have to get this vaccine. You have to get it. Because I would rather know my risks with the vaccine than play my cards and wait and see if one of my kids gets this new Delta variant or something. And hopefully, like I said, Lily got hers, and hopefully we'll get an EUA for the little kids. So anyway, I know this is a longer video. I love you guys, and I hope that you get a lot of information. Please leave comments below. I will do my best at getting to those, and I will continue to just love on you guys and just hope that you guys stay safe. And Dr. Lane signing out.